Well, good morning, everyone. Thank you so much for joining us for the first breakout session of the Thriving Through Connections virtual conference. This breakout session is focused on a very exciting youth drop-in wellness center that is going to be the first of its kind in Orange County. My name is Blair Verasa, and I am the project coordinator at Connect OC and the National Council on Alcoholism and Drug Dependence, Orange County. It's my pleasure to introduce our speaker for this session, Susan Parmelee. Susan is a licensed clinical social worker and the co-founder and executive director of the Wellness and Prevention Center. The Wellness and Prevention Center has been providing easy to access, low fee mental health interventions and prevention education on middle and high school campuses and in the community of South Orange County, California for over 6 years. The Wellness and Prevention Center works with several schools of social work, marriage and family therapy, and psychology to train clinical interns. Susan has been a mental health social worker for 17 years and has experience in inpatient mental health hospitals, Medi-Cal clinics, program development, and homelessness advocacy. Susan believes in empowering community to bring about positive change and is an advocate for youth and families. I can attest to that. One of her main passions is developing youth leaders to address issues surrounding mental health and addiction. In partnership with a private school, Susan developed a peer helper training program that leads high school youth to implement mental health initiatives and to provide peer support within their school. Susan holds a master's in social work from San Diego State University, is registered as a clinician in the state of California. She also holds a BS in hotel administration from Cornell University. So please join me in welcoming Susan Parmelee.
Thank you, Blair. I'm really honored to be your kickoff speaker today. It's pretty exciting. It's a great lineup. I'm excited to see everything that's going on today, the booths. It's just pretty amazing to see this many people come together to support our 12 to 25-year-olds in Orange County. It's a big job. Things are a little scary out there. So as Blair mentioned, I've been working with teens and young adults throughout my clinical career. It's really great to see this shift towards helping them learn about taking care of their well-being and helping adults understand what they really need to support youth. Because I've seen that model shift quite a lot, where we're empowering them to take control of their lives, and I love it. So before we really get started, I'm going to have some, I'm a little disturbed about what we're seeing data-wise about youth mental health during this pandemic. So I'm going to share a little bit of the research that's already come out about this. But before we kind of go into this heavy topic, I really want everyone to just take a minute and pause and kind of think about 3 skills that they've mastered during the past 11 months that they never knew they were going to be able to do. And just think about that for a minute. So I want you to revisit those thoughts, probably daily. I think we know that kind of at the end of the day, if you can revisit and think about 3 positive things for your day, we sleep better, we wake up feeling better about the world. And, when this pandemic first hit, I was hoping it was going to be a sprint. That was a little too optimistic. We are in this part of the marathon where we're all hitting the wall, and it's hard. I was in my professional group meeting yesterday, and we all agreed we're getting to the hardest part of this whole thing. We all managed to transition to telehealth. We all have mastered Zoom calls and different ways of getting together, like this conference. But we all also had hoped it would be over by now. So I just want to applaud all of you who work with youth. I want to applaud all of you youth who have been adopting healthy habits to help us get through this. And I want you to remember those 3 things that you've mastered over this. For me, one thing that it is not, and that I'm looking forward to opening, is my hair place, because I'm not mastering cutting and coloring my hair, or my husband's, but at least I tried. So the Wellness and Prevention Center was developed in response to the growing trends of substance use and teen suicides in South Orange County. Thankfully, we're seeing a decline in substance use issues among our youth and young people. But unfortunately, we're seeing an uptick in the diseases of depression and anxiety, and we're still not figuring out how to master and and prevent suicide, which is kind of scary. So what we do is we provide an open door to mental health services for teens and their families. Some sites are right on secondary school campuses. We're at 3 high schools and 5 middle schools in Capistrano Unified School District. Right now, all services are remote. And we also have several community sites, including services at some of our boys and girls clubs. We also believe very strongly in overall universal prevention. And this means teaching our communities how to support health and well-being. A lot of this happens through e-news. We have online events. We used to have in-person events, and we look forward to that again because I prefer to present in person much more than to my screen. And we also work really hard in this county and collaborating with other agencies. So a lot of the agencies that you'll see in the resource room, we meet regularly, and we, with the direction of the Orange County Healthcare Agency, we help develop collaborated plans to improve the health and well-being of our transitional age youth. So we are really excited about that prevention and education portion, because the earlier we can prevent these kind of mental health symptoms, the better the future is for our youth. I encourage you to go ahead and sign up for our e-news. It's we send it out twice a month. It's just tips and hints and how we can support youth better. And then also we like to highlight events in the area that might that we can send you to that help support our youth and their families. Okay, I lost my clicker. Hold on one second. Sorry. So I'm going to talk a little bit now about social emotional development during a mass trauma. It's clear now that this pandemic has affected every person on this planet. And what we're seeing mental health wise is that perhaps the group that's being most affected by it right now is our young people who have had to totally adapt to how they develop and move through life stages. So we're going to talk a little bit about that, and then we're going to talk about how the county and how the Allcove Project is going to work to solve, to move out of this mass trauma and to support our youth going forward. So one thing we talk about and as clinicians and as educators and as anyone who works with youth is we talk about the stages of development. Erickson's theory is really old and there's a lot of criticism about it, but if we look at it as a framework, it can help us understand what these challenges are right now during the pandemic and why some of the big debates out there are happening. I'm going to start with school age, which is kindergarten through probably the first year of middle school. And this is where we really hope that for youth to successfully transition through this phase, we hope that they can get out, have more feedback from their peers and people other than their parents in mastering skills. These might include some sports. These include adding, reading, some of the basic things they learn in elementary school, mastering a love for art, music. So one of the reasons we hear so much debate about getting kids back in elementary school is they're missing this. They aren't learning effectively through a computer screen. They aren't having the interaction with their peers who help them learn to self-regulate and how they learn to bargain and make teams and do things that promote healthy social emotional development. So as much as so many kids are losing academic skills, I think from my perspective, I'm more worried about the social skills that they learn at this age. This is particularly, all of these deficits are particularly true for our marginalized populations and those who may not have people that can be home to support them. So we have a lot of kids at home trying to be in elementary school without a parent home, or the parent has given up a job and then there's food insecurity because of that, or they're worried about their rent. Adolescence, this is a time when peers become even more important than the school age time. And what we're looking for there is for them to start figuring out their place in the world and what they might want to do with their futures. So again, we have some kids who have had to come home from college, who have lost their jobs and moved back with their parents. And these are steps backwards in their social emotional development. And we're particularly seeing that age group suffer from some anxiety and depression as they lose their roles in the world that they were building. Additionally, we really want kids out socializing, and we've learned that this really isn't safe right now. So so kids sitting at home, not leaving their bedrooms, not even getting time outdoors is becoming a real concern. And then we move into young adulthood, where that's when a young person is supposed to start their career goals. As you heard from my bio, I started in the hotel world, so I actually shifted my role. So it's an exploration time, and it doesn't mean that's where you're going to stick, but it is a time to feel those kind of successes, like, oh, I can do this career. Oh, I can form an intimate partnership. And this is, again, another challenge at times when you can't go out and meet new people, try new things, or even start your college career or potentially your career for your life. So again, these are the three age groups that we've seen a lot of worries about. I'll show you the data soon, but middle adulthood through maturity seem to be doing pretty well because they've already settled and they know where their life is going. There's so much uncertainty for our transitional age youth right now that that there's a lot of concerns, and they need our support now and moving forward. The other thing we've really lost out on through this pandemic is rituals. And we really, as human beings, need rituals. We need to know that we need to be celebrated for our transitions. We need to celebrate others for their successes. And this is the kind of feedback that makes us feel good as a human being. I really encourage everyone to continue to find ways to make these transitions meaningful for the youth in their lives. Make sure these events are intergenerational, make sure they're safe. My adult children have introduced me to Jackbox TV, which is really cool because we play these games from 4 different households. And so it doesn't feel great to have to do all this not in person, but it's what we have to do, and we have to continue to celebrate it. Some of the really cool outcomes we've seen is people taking shorter vacations to the national parks and the state parks, hiking trails. As you know, some have had to be closed because they're too crowded. But this is cool because people are getting a sense, going back to making being outdoors a healthy thing for them, things that they kind of neglected before. So, so there are some pros, but again, everyone's looking forward to getting back, and missing these transitions has been pretty devastating for the young people. And again, back to a little bit of theory and Maslow's hierarchy of needs. What we do know is that you need to be safe and have food and water, and then you can work on higher level things like feeling good about yourself, building a family, supporting family members. We're going to see in this data that the people that are losing their housing and their jobs and don't have income are definitely having a much harder time right now, as in regular times. And then we take the marginalized populations who can't even do the things I'm talking about through a computer or a phone because they don't even have access to Wi-Fi. So this is a little meme that, I don't know if that's a meme or a cartoon or a drawing that's been circulating on the internet that just kind of shows where we are as a society and how so many people are left out even further because of poor infrastructure and Wi-Fi. So there's an organization called covidstates.org doing the majority of the research in the country right now. And they are several different institutions of higher learning that have been surveying throughout the start of the pandemic. And in October, they focused on 18 to 24-year-olds and what is impacting their lives the most from the pandemic and quarantining. So, surprisingly, 20%, nothing was really a challenge to them right now. Their lives pretty much continued as they had. Even they may have gone to virtual school, but they didn't list that as a challenge. 41% started working from home, 50% are schooling from home. Again, those kids that wanted to launch off to university or launch to living on their own have been held back. The group, though, that we're most concerned is in the green box. Those are the ones that we're seeing the most increase in symptoms of depression and anxiety. The other groups, we may be seeing a slight increase, but again, it's those that lost their basic needs, their safety, their housing, that we're the most concerned about. It was good to see that only 3.1% were evicted from their homes, but I'm a little scared about what's going to happen as we move forward and we don't have these protections in place to keep their housing. So these are things to really think about with the young people we work with, and remember how important some of the basic needs resources are for our TAY population. And if you're anywhere that touches the lives of TAY individuals, please let OC Connect know what resources you're looking for, or the Wellness and Prevention Center, and we can help you connect those youth to those kind of resources. So again, during these times, we're really worried about the fact that we're seeing more of an uptick in depression and anxiety and thoughts of suicide. And you know, I've learned of a few suicides in the county from our youth, and it's terrifying. It happens, again, something we're really working very hard to prevent. We need to really, again, pay very close attention for those who have lost their income and their housing. So as part of our Allcove project and our state funding that will start soon to work on the youth center, we have been holding informal focus groups with our youth, both here and at UC Irvine. The partners on the project are the Wellness and Prevention Center and UC Irvine. We were asked to write this grant together by the Orange County Healthcare Agency. And we are really excited to get going. It slowed down. I think a lot of people's projects slowed down during this time, but we're trying to get a jump. We're doing some surveying of the youth, and in the focus groups, what we're finding is they want to access help, but they're not always sure how, and they're not always happy with who's there to provide the help. So we're trying to be very we're trying to learn these things so that as we go into the planning process, we really understand what it is that they need. They're all saying that this has impacted their mental health and well-being, and that this feeling of uncertainty is really a little scary for them. So these statements came out of some focus groups with our South County youth. Most of them are still in secondary school. Some of them have started school, college virtually from home. And then we also held some focus groups at the UC Irvine, through the UC Irvine campus, again, not in person. They talk about, again, the same things we've mentioned: missing milestones, difficult transitions. They're also still looking at bigger world pictures, particularly climate change and how the economic recovery is going to happen. What they're finding on their own college campus is that resources are not easy to access. So not in the moment when they need them. These aren't crisis situations, tend to get attention almost always get attention immediately when we're aware of them. But some of the just day-to-day stuff, when they just want to walk in and talk to someone, they cannot find that situation. They also find that the adults that work with them aren't comfortable talking about mental health issues with them. So they may go to an adult that they are comfortable with because they're in their classroom 3 times a week, but then when they go to them to say, hey, I'm struggling a little bit, they're not really equipped to handle it, which kind of supports what's happening in Orange County and across the state in working on teaching educators, since they have the most contact with our youth other than their parents and peers, need to have more education on how to talk to youth about mental health. Again, as we all know, the marginalized populations were struggling more before the pandemic. They're struggling more now, and a lot of the initiatives that are funded right now have to do with very much targeting these populations, particularly LGBTQ and people of color. Everyone's a fan across the 12 to 25 age group of peer support, and this is a model that has gained traction across the country and across the world, and we are working hard to be on the edge of that and really work with making accessible trainings for youth and then supporting these youth who want to provide peer support. And again, people want to talk to people that are like them. This is what kids feel comfortable with. This is what adults feel comfortable with. I mean, I see it in trying to recruit clinicians. It's very hard to find clinicians that match the population that we serve. And we would like to see, which is why we have a robust intern program. We'd like to see more people trained as professionals of every color and every sexual orientation and gender orientation. We work very hard at this, again, but this is a bigger systemic issue that we really need to be looking at as a country. And then again, they want to be able to just walk into this space and not have to see anyone, not to use a service. They just want to maybe sit with their peers and feel that there's a place that they belong and that they're connected to. So we really enjoyed meeting with these youth and finding about, what their concerns are, because this is an important part of the planning process. And as you'll learn, this is a very youth-driven project as I get into the next phase of this presentation. Their biggest worries right now, some of their thoughts about quarantining. We had a lot of feedback, and I really hope adults and caregivers will listen here. We got a lot of feedback that adults are crossing the boundaries and putting all their worries on their kids. We have to remember we're the adults, and if we need support, we should go to other adults. Kids aren't equipped to take on the worries we have. In fact, it just adds to their worries. In their future, again, how we handle this pandemic, climate change, getting a job, and job security, all the things we discussed, that those kind of uncertainties make it really hard to just get through day to day, not knowing what it's going to look like moving forward. So I wanted to just pause and see if there was any questions in the chat box, or any questions you might have before I introduce the alcove to you. Blair?
I've not seen any questions so far in the chat. But the findings from these focus groups, interesting. Yes, I'm having some comments in the chat though that the findings that you mentioned from the focus groups are definitely relatable. That's coming from a current UCI student, so.
Yeah. And one of the things that was really interesting is they have a lot of services, but there's no real clearinghouse. And I think we know this at a county level too, which is why some of the funding that's come through has been to develop these resource guides. So they noted that there's several different efforts going on, but they're not centralized. So part of Alcove is to centralize services, so you know how to get there. And also the accessibility being at the wrong times of day. That we need to be adaptable to the schedule that youth live by, which is something that schools need to do in general that we haven't done yet, and let kids' bodies get the sleep the way they need it. So that's an important part in how it's open, and also how to find all these services and time together. And sadly, between UC Irvine, and also I've spoken with some professionals at Saddleback Community College, there's just a wait list and kids can't get in there, and then there's a limited number of sessions. So how we make the door open and let kids at any level that need some help access it when they need it, and not have to wait and not have to have the services limited, is a really important part of this project.
I'm getting another comment here as well. Maybe this will be a place for that, this upcoming youth center. I wish there was a place young people could go to talk about their mental health, like group therapy sort of, and also a place to make friends and socialize.
Right, and that's going to be an important component. Everyone, we've held a lot of sessions with high schoolers. That's our area of expertise, and then UC Irvine's bringing more of the college age kids into this. Is that they just need a place to go to be. They just want to be, and they want to feel safe there. So this is going to be an important part of that, and group activities is also going to be a very important part. We envision walk-in yoga. We envision people, if they want to bring their instruments and sit in a room and play music together. We want to have an art room. There's a lot of great things that we're looking at, and none of these services will have a charge, but we'll have a fee. So is it time? Should I show everyone Alcove, Blair?
We can. We do have a couple more questions. Would you like
let's do those first.
Oh, great. Fantastic. All right. So our next question is from Leanne. She writes, is the rise of depression and anxiety during this pandemic due to how people are facing their inner conflicts that they have been avoiding for a long time?
Oh, good one. So one of the things we do know is that families and couples are having way too much together time, and we're in the same house and we tend to not be getting out of the house. So a lot of people don't have enough space. So in terms of inner conflicts, I would say, yes, the interpersonal conflicts are being emphasized. And other things, sitting around and having too much time to think and to ruminate, we're definitely seeing that. So getting kind of stuck and spiraling in thoughts because you're been sitting in the same place now for 11 months and not, not interacting with others very much, and getting that kind of positive social feedback that we need. So I would say there isn't real research about this, but my own anecdotal experience is absolutely.
Another question we have is, do you believe young adults amplify the anxiety of their parents multiple times?
We're definitely seeing that, which is why I kind of brought up that thing with youth saying the boundaries have gone, like they're kind of treating them like more like peers than their own youth. And it's hard for parents to not feel anxious right now, but then I really encourage parents to try to filter that anxiety somewhere else, because kids really need to feel safe at home right now. So for sure, I mean, we've always had young people that come to us that are absorbing the anxiety of their parents. That's not unusual. But I think right now it's probably definitely heightened.
Mm-hmm. All right, just a couple more questions from Don. I'm depressed. How can I fix that? I'm sorry,
is this from, well, we'd like you to talk to someone. So if you want to reach out, my information will be at the end, how to find us, but you can email me at info@www.wpc-oc.org. And that will be also, you can visit our resource booth and a bunch of other ones that provide supportive services to transition age youth. Because if you're feeling depressed, we want to help you right now.
Mm-hmm. Definitely. And just to mention that I will also be dropping into the chat conversation links to a few crisis lines and NAMI warm line.
Thank you.
Which you can access right now. It's available 24/7 for text or call. So I will drop that in the chat. One or two more questions. Does the Wellness and Prevention Center only serve college-aged youth in South Orange County, or can youth from all over the county receive services?
Right now, because of telehealth, we are available across the county, and we've been working across the county. So if you need to talk to us right now, please reach out. Again, if it's an immediate crisis, use a text line or 911, but we are trying to be as open a door as possible, because we know it's hard right now and we have space in our caseloads.
Fantastic. All right, two more questions left. What resources or outreach is being done for people of color? I would imagine this target population would be harder to reach due to maybe not even being aware of mental health. And that's from Jose.
Okay, great question, Jose. What in all of our universal prevention planning and all of Orange counties for everyone in this county, everything is translated. We do our best to target the areas where we know there's more higher populations of people of color with our public service campaigns. I'm going to show you ours at the end. So it's a very driven effort, and I also know there's a brand new position at Orange County Healthcare Agency that's going to work on health discrepancies. So that's really exciting that department's coming out. We try to reach these populations, and we design our campaigns to meet what we know from the research is what their needs are. And all of our focus groups and the group that's going to help with Alcove is going to be a diverse group of youth.
Fantastic. All right, last question for right now. Maybe we can hold the rest of them till the end, but Luce is writing, what are ways we can help ourselves and our parents if we are feeling stressed or anxious?
Okay, I am a huge fan of meditation apps and group meditation. You can do it. I've done it with groups of teens. I've done it with groups of Marines. One of my favorite is the UCLA mindfulness app. Everything on it is free. And their guided meditations, there's hundreds up on that one, and different people speaking. And I think it's a great practice. The other thing to support parents and family, I like to tell young people, do a couple extra tasks around the house that they don't even know need to be done, that they don't nag you about. That's just a really simple way to support support adults and caregivers when they're stressed out. So, you know, that means like if the trash is full, take it out. If there's dishes in the dishwasher, empty them. If there's dishes in the sink, clean them. If a car needs to be washed, go do it. Because you have these skills, you just don't always remember that they need to be done. And then in general, as a family, I want, you know, it's important maybe to schedule, if you're not all in one place, schedule a weekly time that you are on a screen, and also schedule kind of sacred ritual activities, like every Sunday, everyone has dinner together. These kind of things really are what get us through the week and help relieve stress and anxiety, especially for those of us, those of you out there who have family members that are working in frontline jobs right now.
Fantastic. We do have a couple more questions, but maybe I'll hold those until the end of the presentation.
Yeah, we definitely will have time in the end, but let me show you Alcove and then hold those questions and we will get through all of them before we finish today. And if not, Blair can send them on to me on the side. So we're now going into a slideshow completed by the Stanford Adolescent and Youth Psychiatry Department. And I'm sorry, my notes aren't showing. So some of this now I'm gonna jumble my words up a little, but these slides will be available for you after. Alcove has been in the works now for, I wanna say probably 8 years. And it's a very exciting project. So this started up in Stanford when we were seeing this got particular attention in Palo Alto, where there was a disturbing number of youth suicides. And it had Stanford decide to focus on how do we better support young people in Palo Alto and potentially the entire country. So they looked at a lot of different models across the world and did a lot of research, a lot of talking with youth, and this is the end project, which is going to be implemented across the state and hopefully eventually across the country. So what they found when they started their research, and I will say this graph is from 2001, however, it's still really quite true about what's going on. We've now know that transitional age youth from the ages of 12 to 25 have mental health needs that are almost equal to their physical health needs. And we also know that if we could intervene early when the symptoms first occur, then we have the potential for better outcomes and less chronic mental health disease. We know that 50% of all lifetime cases of mental illness start by age 14, but unfortunately, just only about 1 in 5 access care. And so the Allcove model is here to help make sure we get more youth accessing care early. Sadly, in the US, suicide is now the second leading cause of death for individuals ages 10 to 34. And this really is not okay. It's frightening. And this project is hopefully going to be a good part in changing that statistic. We really want to look at the 79% who are not accessing care and figuring out how we make it easier for them to access care. So a lot of young people were interviewed just like we're doing right now and polled, and they all support a place where they can walk in, feel comfortable, and find services that they need. When you look at Alcove, it's meant to be part of the mental health continuum. We already have, places where youth go to access mental health care, but Alcove is going to kind of be in the middle of it, maybe in the start of it, maybe as a place to refer up to higher levels of care. But as it becomes a well-known name, we hope that school and mental health programs and primary care physicians know that they should send kids to Alcove for a safe, for a comfortable place for them to be and just hang with each other and to learn more about how to take care of themselves. And then we also know it's going to be a very important place to make sure that youth who need a higher level of care are referred out to places that will provide that care, like Mission Hospital, Chalk, UC Irvine, and other professional medical providers. So again, this was designed with, by, and for youth, and they will serve ages 12 to 25 and their families. We do envision this as a place where mostly the young people go, and the young people have said over and over, we do not want our parents there. So, but a family is still an integral part of a young person's life. So there can be as little or as much family involvement as needed. Although my vision is that most of the family kind of therapy and things like that will not be happening there. But if a family is struggling for food, it's going to be a place where they learn where to find food. If a family is struggling for rent, and that's that we can help them connect to the resources and other social services that they might need. So the branding, the youth advisory groups in Santa Clara and Palo Alto County, which are where the first 2 alcoves will open, and which actually are very ready to open their doors when it's safe. The name was designed and trademarked by these first 2, well, it's trademarked by Stanford, but it was designed by these first advisory groups, and will be the name that's used across California. Each center will have its own youth advisory group, and our vision for Orange County is to have a centralized center at University of California Irvine, and then a lot of branches of centers all across Orange County, with the first ones being in South Orange County. These youth that join our youth advisory group will be a part of a community-wide prevention campaign as well, to help encourage help-seeking behaviors and reduce stigma about the diseases of mental health and addiction, and just to educate, to raise awareness among youth that they're not alone and that there's people there to help them. We anticipate that if you're part of our youth advisory groups, you will serve for about a year. You will need to dedicate about 20 hours a month to the work that we'll be doing. There will also be other opportunities to participate at a lower level. I believe up north they're being called ambassadors. So that can be a position that can be for youth and adults in the community. And there will be opportunities for adult participation in the planning process. So I think what's exciting about it for youth is you're going to get the chance to interact with professionals in their fields, and these are fields that you might want to go into. So there are a lot of things that happen when you're building a business and a center that are applicable to other careers outside of mental health and physical health and other well-being. Again, these were the mission, vision, and values developed by the first youth advisory groups, and these will be again standard across all the groups we meet with. So these are just some of the basic starting points for the planning process. These are the core services that the state has said must be included at every Allcove site. So this is under the Mental Health Services Act Oversight and Accountability Commission. So to maintain the integrity of the model, Stanford will be the technical advisor on the projects, and we'll be working with our youth advisory groups and our adult professionals that are involved in this process. As someone who works in the mental health field, what I'm most excited about is taking care of your mental health and well-being just a normal part of life. From age 2 and up, you go to the dentist every 6 months, but you never have a mental health well check. It's getting more adopted at the pediatrician's office, but what we'd like to see is youth taking ownership of their mental health, wellness, and well-being. And this is going to be a place where they can learn how to do that. And they can come as many times as they want. They don't have to wait every 6 months like the dentist. It's an open door, and they can come in anytime to talk to people. And if they move to another part of the state and eventually across the country, when this model gets more adopted, they can walk in that door too. They know what it means to go into an alcove. So again, we kind of goes back to they're going to be connected with the same core services, standards, and brand. However, each community gets to decide what that looks like. Similar to, let's go to a McDonald's franchise, similar to that. So if I buy a McDonald's franchise in San Clemente, I might decorate it with surfboards. I might have it close at 10 because we don't stay out late. And, I might put a bike lane to meet the needs of my community. Whereas maybe Los Angeles is going to be open till midnight because it's in a city, there tends to be more late night hours, and they might decorate it a little differently to match their city. their community where they're located. But again, the services are the same. How people are trained is the same. What the mission and brand are the same, so that anywhere you go, you know, you can walk into this and get, going back to the McDonald's model, the same Big Mac. And this goes on to a bigger international network. Stanford's very connected to these projects as projects across the world. And because we become a global economy and youth go overseas for school, youth go overseas for jobs, they will know that there's other places that are the same as Alcove and other areas that they might be. So these are models that are successful and operating right now, and having, you know, youth know that they can go into these anywhere they go. So this is Dr. Steve Adelsheim, and he is the basically the original adopter of the Allcove model, and his program director, Vicki Harrison. They love your questions too, so feel free to reach out to them and go to allcove.org. You can also contact them there. We're really excited about this partnership. We've been talking for years about how to make this happen in South Orange County. They will be down here to meet with our youth. And again, here's the Alcove information. I believe at Alcove Youth is a Instagram. I'm a little behind in social media, but I do believe I follow it. So feel free to follow them to learn more about the efforts up north and then across the state. And that's kind of it with Alcove. So we're back to my slides again. So how can you help? You can send me an email and let me know that you want to. Well, I'm going to tell you that more in the next slide. But for this slide, I want to introduce the campaign that is now running here in Orange County. And we want to encourage everyone to talk about mental health. So this campaign is targeted mostly in South County, and it is in English and Spanish. And if you click through to the webpage, there are links to how to talk to your parents or your guardians and other adults in your life. And conversely, there are links to talking points on how you can talk to the youth in their life about mental health. And you know, as you leave here today, what I hope is that you'll really take the time to ask 3 people every week how you really are, and you'll take the time to listen and empathize and just support others, because right now what we're finding is connection is more important than ever. We know that connection is basically the opposite of depression, and people are very disconnected right now. So I just beg you to talk to at least 3 people meaningfully this week. Additionally, when they ask you how you are, don't just say fine. Tell them. You can say, hey, you know, I'm kind of proud of, you know, how I got through the last 2 days because I had a really challenging situation at work, and then I also had finals. You know, really talk, use words, say how you feel about things. We need to make it matter when we ask these questions. And finally, if you're interested in the Allcove Project or in supporting the well-being of young people, just send me an email. I will tell you the opportunities we have. We definitely are recruiting for the youth advisory group right now. And we always have opportunities for youth and adults to work with the Wellness and Prevention Center. Or if we don't have something that matches you, we know who does. So I really appreciate the time you spent with me today, and I want to leave a little bit more time for questions. Blair? Do we have any questions right now?
Yes, Susan, that was really excellent. And I know that we'll continue on with the chat throughout the day, but we've had about 40 or 50 people join us after your introduction. If you can go back through and tell us a little bit more about you and WPC before you sign off here.
Sure. So I'm Susan Parmelee. I'm a licensed clinical social worker and the executive director of the Wellness and Prevention Center. We provide an open door to mental health services for youth, primarily in South Orange County, but as we talked about in the last question section, we are open to youth across the county right now through telehealth. But we sit on 8 middle and high school campuses and let youth walk in to talk about what they need, and then we also take on clients for several sessions who might need more support with problems they're having with mental health symptoms, with any of the above. And we also provide extensive universal prevention education throughout South Orange County.
We do have one question, Susan.
Okay.
That was just to re-clarify whether Alcove is available now to students virtually, or if they need help, support, or someone to talk to. Are these, when will these be live?
So Alcove, I don't know what's going on in Santa Clara and Palo Alto right now, and if they're what kind of services they're providing at the moment. It is not available in Orange County yet. We're about a year out. But if youth need to reach out right now, they can reach us, or they can use the NAMI hotline or a warm line or one of the crisis lines. We're happy to talk to any youth right now in the virtual setting.
Perfect. We have one more question too, and that is regarding the youth advisory group. What are the requirements to join?
We have not made those requirements yet. We will, if you send me an email, I'll put you on our email list. And yeah, so you should email me right now. We will have a formal application process probably by February or March, but we will have activities going for the interested youth in the meantime.
Perfect. And one more question is,
okay.
Will there be opportunities for working in person at one of these health centers that you spoke of?
Yeah, and what it will look like is peer support. It will look like college students maybe having stipend positions to support younger students. That's kind of some of the things we see moving forward. There definitely will be a lot of opportunities for both volunteers and for paid positions.
Perfect. And that looks like it takes care of all of the questions in the chat. So unless anyone has some last questions for Susan, drop them right in the chat for us.
And Crystal, I just wanted to add that just to remind everyone in the resource fair area of V-Fairs here, their Wellness and Prevention Center has a booth that's a little more interactive where you can get up-to-date and current information from them. And I know some of their staff are also on here that you can chat with throughout the day.
Yeah, we always like hearing from anybody out there. So just give us a call. You know, we always can make time, usually within 24 hours, to talk to you.
A couple more questions coming in.
I love it that someone likes our booth. Thank you. That was really, those booths were so hard to set up. I'm just saying.
some technical learning curve to put this all together for sure. One question in here was, how do you get parents to understand why you struggle with mental health? Any recommendations of that?
Yeah, we work with youth a lot that are having trouble talking to their parents and helping them to understand. And sometimes it takes us also talking to the parent. There are a lot of sites out there, websites that can help you. The one that links through our talk website is Mental Health America, and has great tips for parents on how to talk about mental health and tips for teens on how to talk about mental health. So if you go to Mental Health America, you can find those talking points. You can also find them at our website. There's a drop down that under, I think, resources that says the talk on our website, or if you can't find it, just email us at info@.
And I think we have maybe two more questions. One is whether or not these services are available in LA.
For Wellness and Prevention Center, or for Alcove?
I believe both. This is referencing Alcove.
Yeah, there's two sites that are going to happen in LA. Again, these contracts haven't been signed, unfortunately, because of COVID. But we've been assured they will be soon, which is then about a year out in the planning process for opening doors. But my thought is that if those are the people with the working on the projects, they'd be great to reach out to. And a lot of services for young people are virtual right now, but in these newer communities that were just awarded the Allcove Project, we're at least 12 months out until we open doors.
And just to make sure that this wasn't referencing Wellness and Prevention Center.
If you are in LA and you need help right now, you can call us. We may try to connect you to services in LA, or if it's something we can help you with briefly, we would help you.
Perfect. I think one of the last questions is just regarding internship opportunities through Wellness and Prevention Center. How can a student get involved more with your agency and help get involved in the work that you do?
Depending on what age you are, anyone at this point can join our interest groups for the youth advisory group and participate in some activities. You also, if you're a college student and doing something in the human services field, we definitely can help you with your school hours for internships. And we also have graduate interns all the time. We have about 8 of them right now, graduate student interns that are working on clinical degrees. And then if you just want to come and volunteer as a youth, we have a youth coalition that does a lot of great prevention work in the community.
Perfect. Awesome. And I think there's maybe one last question here in the chat, and I think this is something similar to what you've touched on already, looking for advice on how to communicate your problems to your parent and struggling, with being able to communicate those needs to a parent.
Right. And just know that if your age is 12 and up, you can self-consent to see a mental health professional and ask advice. So that means you don't have to ask your parent to access it. And we want you to reach out. And if you need help talking to a parent, most mental health professionals know how to do that. Certainly you can contact us for some one-on-one help with that. I suggest your timing's going to be really important. It needs to be a time when your parents are open and receptive and ready to sit and have a conversation. And that sometimes can be hard to find right now. But I really suggest you to say, this is what I know about my mental health. This is what's happening to me. And I really wish I could find someone to help me more. And I wish you support me in this journey. So just making it about you and not being really careful not to say, you never help me. You never do this. You don't understand me. Try to take it more as what it is about you that you want them to know.
Perfect. And we'll go ahead and drop your email, Susan, and I believe Lauren is online as well, into the chat so that anybody that has questions or is interested in internships that they can contact you directly. Correct?
Yeah, and the info email, it's one that says info right here on the slide right now, that comes right to me as well. Or you just put Susan at the front and it'll come to me as well. Both of those will come to me. But Lauren's great too. Send her a bunch of emails as well.
Perfect. Lauren's laughing in the chat. So.
There you go.
Right. It looks like it's the last of our questions. And thank you, Susan. We really appreciate you being here this morning and being kind of the kickoff a little bit for this event. A whole learning curve with, doing everything virtually, but we're happy to have you here and happy to, learn about this new opportunity that's coming to Orange County.
Yeah, well, I was honored to be your first speaker, and I look forward to next year seeing everyone in person because I really like seeing people's faces when I'm speaking. So I'm really looking forward to that too. And I'm looking forward to a great day. There's so much going on today and I'm very excited. So thank you for planning this.
Good.
Yeah, absolutely. Thank you. And to answer one person's last question is asking about if they can access the recordings of these sessions. The answer is yes. For 1 month, you'll be able to continue to log in much like you did today and access all of the recordings and the virtual environment.
And I'm also happy to present to other groups about this project if needed.
Okay, good.
Perfect. Right. Thank you, Susan. And for everybody attending, we appreciate you attending and having such great questions for Susan today and participating. Enjoy the rest of the conference. There's a lot of fun stuff to do out there in that virtual environment. So rack up those points and get on that leaderboard so you can win those fun prizes.